Virtual Fracture Clinic. Toe fracture.
Hi, I'm Andrew Oppy, an orthopaedic consultant at the Royal Melbourne Hospital. At the Royal Melbourne Hospital, the Virtual Fracture Clinic is run by specialist orthopaedic consultants and advanced practice physiotherapists. In many cases, we can review your injury and provide care without you needing to come back into hospital. This video will give you the information you need to manage your recovery. Each toe is made up of smaller bones called phalanges. A toe fracture refers to when one of these bones is broken. A broken toe can be very painful, but in most cases will not need surgery. Broken toes are usually caused by trauma, such as kicking an object or dropping something heavy on the foot. You can expect to feel pain and see swelling, redness, and sometimes bruising in the area. When your foot is examined, there will likely be a point of maximum tenderness over the fracture site. On your X-ray, we might see a crack or dark line. This is the fracture or break. An orthopaedic surgeon can determine if an operation is required. However, in most cases, this injury will heal on its own given some time and support.
Treatment.
Once a specialist has determined no operation is needed, the most common treatment is to wear a stiff-soled shoe with a wide front to support the toe and limit movement for 4 weeks. A sneaker or work boot are good examples. You may be advised to buddy strap the toe for additional support. We will explain this in more detail later. It is safe to bear weight on the injured foot, though this may cause discomfort. Try to reduce your stride length to minimise bending at the toes. You may prefer to heel weight bear if this is more comfortable. Use your pain as a guide to how much walking you do in the first weeks of your recovery. You can expect some discomfort, but feeling very sore is a sign that you should rest more. As with most bone injuries, this fracture is expected to heal in 6 to 12 weeks. If you are a smoker, this can slow healing time, so we advise that you cut down or quit. You will not need to come back to hospital or have any more X-rays. However, if after 3 months you still have pain or are walking with a limp, contact the Virtual Fracture Clinic or visit your GP.
Can I drive?
You can drive when you can walk comfortably and could safely perform an emergency stop.
When can I go back to work?
Getting back to work will depend on the job that you do. A desk worker may return in a few days. Someone with a very physical job may need 4 to 6 weeks off. Speak to your doctor if you need a medical certificate.
Can I stay active?
You can return to playing sports or the gym after 6 weeks. You should have near full motion, at least 85% strength, and little, if any, pain. A doctor or physiotherapist may clear you to return sooner if that is your goal and you have completed your rehabilitation.
Care at home.
Hi, I'm Emily and I'm a physiotherapist at the Royal Melbourne Hospital. You may be advised to buddy strap your injured toe to the next toe to provide support. The tape will need to be worn for 2 to 4 weeks to be effective. Place a small piece of gauze or cotton wool between the toes. This protects the skin and stops the toes from angling together. Loosely wrap the 2 toes with a rigid tape. Do not pull the tape too tight. The injured toe should remain straight. The tape can be removed for hygiene. Purchase these supplies at the pharmacy to reapply. The strapping should provide support. If the injured toe hurts more when strapped, remove the tape. If you need more support or don't have appropriate shoes, you can wear a post-op shoe, which has a stiff sole. These are available from equipment suppliers or online. Foot and ankle injuries can be very sore. You should make sure to rest and spend less time on your feet than you usually would. Elevating the foot above the height of the hip can help. It is also advisable to use an ice pack or frozen peas over the area to help with swelling and pain. Do this 20 minutes, 2 to 4 times a day. Wrap your ice pack in a tea towel or cloth. Never place ice in direct contact with your skin. If your pain is not improved with rest and ice, you could try over-the-counter pain relief such as Panadol or Nurofen. If you are still very sore, consider an appointment with your GP to talk about other medications. After 2 or 3 days, start these simple exercises to help your recovery.
Exercise 1. Ankle range of motion, dorsiflexion and plantarflexion.
Move the foot up and then down. move as far as you can within the limit of discomfort. You should feel a bit of a stretch. Repeat this about 10 times.
A model moves her foot forward and back repeatedly. Exercise 2, ankle range of motion, inversion and Eversion.
Move the foot side to side in a scooping motion. Repeat this about 10 times.
Still on the bench, the model waves her foot side to side repeatedly. Exercise 3.
Use a towel or scarf around the top of the foot to gently pull the foot back towards the leg. Hold until you feel a light stretch. Hold this for 10 seconds and repeat 5 times.
Exercise 4. Toe range of motion.
Gently move your toes up and down as much as comfortable. Repeat this 10 to 20 times. Most people will not need any special rehabilitation after a toe fracture. However, if your walking does not return to normal after 4 to 6 weeks, you may benefit from seeing a physiotherapist. You can see your own physio locally or contact the Virtual Fracture Clinic to arrange a physio appointment at the hospital.
It is important that you understand these instructions. You are in charge of your own health. If you have any questions about your recovery, contact your GP or the Virtual Fracture Clinic.
The Melbourne Royal Hospital.